Hi, my name is Darla Hobson, and I'm a clinical therapist for Claremont Unified. And today I want to talk to you about mental health for teens. So here we are in 2020, and it has been a year of challenges. I think none of us would have signed up for what is happening, but we're all a little bit stressed and we're all navigating new territory. And so today I want to give you some tips about how you can identify stress in your teens and what you can do about it. So, what kind of stress reactions are we looking for? Well, this is true of teens, but also of all of us. Stress reactions could be feeling overwhelmed, frustrated, angry, worried, or anxious. Also, feeling restless or agitated or on high alert, maybe unable to calm down. Some of us worry about being in public spaces, worry about getting sick, or worry about touching germs. Sometimes teens express their stress by being teary, sad, or fatigued, maybe just very tired. They might lack motivation, have a loss of interest in enjoyable activities, or have difficulty being happy. And to be fair, right now, a lot of activities that we enjoy, we're not able to enjoy as usual. Also, constantly thinking about the situation or feeling stuck. And it's common for teens to have somatic symptoms, which means that they have physical symptoms like stomach aches or headaches or just not feeling good when they're feeling stress. So, what do we do? As parents, one thing that we can do is we can make sure that we create and maintain routine, structure, and consistency. And this is especially true in terms of sleep and activity. Our students need schedules. They need to have certain times to sleep, certain times to do the schoolwork or necessary work, and they need time to relax and decompress. Staying connected to others and sharing humor is a really important part of mental health. We want to make sure that we stay connected as families, but we also want to make sure that our teens connect to their friends or support networks because teens are social creatures. Also, talking about feelings and worries is helpful, and limiting stimulants such as caffeine and sugar or energy drinks. Our diet and the things that we put into our bodies, particularly stimulants, can worsen anxiety. Getting physical exercise is really important, and it's so easy when we lack motivation or we don't have a lot of energy to skip physical exercise, but it's so important in terms of creating more energy and motivation. Also, limiting exposure to news and other distressing media because that can just increase the stress. Other things we can do is incorporating music or dance. Things that we can do as a family is maybe turn on some music, have a little dance party. Ask your teens about music because they connect with emotions through music. So if you're not familiar with what your teens are listening to, maybe you want to talk to them about it. As a family, you could do crafts, or you can encourage reading if your student likes reading, journaling, or family games. Just doing a simple game night is a way to connect and de stress. Also, families can practice mindfulness or relaxation activities together. For some people, if you have a spiritual focus in your family, that might look like prayer, praying together, or encouraging prayer practices. But it can also be something active, taking a walk together, just doing anything that keeps you in the moment instead of worrying about what could happen or what has happened. And also, it's important for us to remember that we need to be kind to ourselves and others. Maybe give a little extra grace because things are hard and people get a little bit tense. How do I relate to my struggling teen? This is a hard thing. Sometimes, especially when teens shut down, it's hard to know what to do. So, what we recommend is to listen non judgmentally. So it's so easy as parents to want to solve the problem, but sometimes we just need to understand. We need to think about what it was like when we were a teen and realize too that we never went through anything like this when we were teens. Also giving reassurance that it's okay and we're going to all make it through this together, and that even if things are hard, we have the tools that we need to be successful. Encouraging professional help and making arrangements. Sometimes, if feelings of being overwhelmed or depressed or anxious persist, we need to seek professional help. And there are a number of ways to do that, and I'll go over that on the last slide. Also, utilizing support communities, finding ways to make sure that your teen is connecting to their community of support with their friends, with extended family, and also with church families or other social groups that your family might engage in. And always ask your teen about safety. Make sure that they are feeling safe, that they're not hurting themselves. And if you're in doubt, call 911. So resources, if in doubt, yes, call 911. If you think your teen is having suicidal ideation, if you're concerned that they might not be being honest with you about it, if they're self-harming, it's important to seek mental health help. And if you are in doubt at all, it's always better to be safe than sorry. Also, Claremont Unified contracts with caresolace.org for help with appropriate mental health referrals. You can go on that website and they will help you find whatever resources that might be helpful for you. Also know that the district has counseling resources too. Contact your guidance counselor if you feel like you have a need for school-based counseling. And you can make sure that your teens have numbers like the crisis text line that they can use if they don't feel like they can call somebody, but maybe they feel more comfortable texting and they feel like they're in crisis. And also, there's a distress helpline, suicide hotlines. It's important to make sure that we have those numbers on hand and make sure that our teens have access to them. And that concludes my presentation for today. And hopefully it was helpful. Good luck as you navigate these uncharted waters.